just about a year, we have experienced a shattering event in our lives, the coronavirus pandemic. It is not like being hit by a hurricane where physical recovery is a few weeks and economic recovery a bit longer. This pandemic has made us rethink who and what we are. Along with this drastic change, we have come to realize what is important in life and in our lives. One of those things is yourself and your family, among other important factors. With excess time for many who have reduced workload, changed schedules, or work, many persons became more health conscious. There were more people exercising and moving than normal, whether on the road or in their homes. A new healthy perspective has emerged: staying active. DCOM spoke to Dr. Sonia Swangston-Mead to elaborate on the topic of being healthy and staying active.
I think that's a very good question, especially as you are referring to, especially with the pandemic. I like to think that we should be trying to do this all the time. But perhaps maybe we concentrate a bit more on that because of the pandemic. And in that sense, if that is what we have to do, then maybe the pandemic is a good thing, because then it helps us to think a bit more about how we can control and improve our health. So I believe that the pandemic is an incident, yes, but my philosophy is to be doing this all the time to try to maintain good health and to prevent ill health. You know, again, we are hearing a lot about it now. That's true. But the immune system is something that didn't just start with the COVID pandemic. The immune system has been around from ever since. And we continuously speak about this because we talk about preventing colds, preventing cancer, preventing diabetes, preventing hypertension. And all of those illnesses that I've just mentioned, they come about because of a weakness, I would say, in that particular area of the immune system. So your immune system basically is something which your body, which everybody has that. It's the ability to fight off or to ward off the effects of something which can influence our health in a negative way. I would put it this way. So it is usually consistent of blood cells, white blood cells usually, and then there are certain proteins that are produced in your body which are called the immune globulins, which help to ward off bacteria, cancer cells and that sort of onslaught or threat, I would say, to our health.
I stay active by cycling. I've been cycling for 40 plus years. It's a great sport. It's very popular here on the island. We have all age groups from the little tiny 10-year-old all the way to 65, 75-year-old. It's a great competitive sport. I guess many of you all have seen us on the airport roads on Tuesdays and in lowlands on Thursdays and Saturday morning in Phillipsburg. It's a great sport for the entire body, mentally, physically, and great for the cardiovascular system. I encourage you to pick up cycling.
A good immune system starts at birth, and it starts with breastfeeding. When a child is born and their mother feeds them with breast milk, that breast milk, actually the very first effluent from the breast, which is called colostrum, is packed full of immune globulins, which helps to get that infant started on the right track as far as the immune system is concerned. And breast milk further on, contributes to that and is the best start for a baby in order to try to make sure that they have a healthy start. They learn immediately about proper nutrition, even although they don't know what they're learning, but that's what they're learning. And so total breastfeeding for 6 months, which is what is currently recommended before any substitute is introduced. If possible, that's the best way to start to get the immune system going in an infant. And of course, we have to be infants before we grow into childhood and before we become teenagers and before we become adults. So from there on, it's basically the same concepts again: proper nutrition, the avoidance of threats, and those threats are germs. I guess we could refer to them as germs. And therein, from very early on, we teach our children to wash their hands, to brush their teeth, to be careful how they clean themselves after going to the toilet, and so on. So all of those little things which are social norms are actually contributing to that child's development of their immune system, because what we're doing is trying to minimize the effect of germs in their environment. And then, again, as kids, nowadays I think it's a little bit different because kids have screens to look at. But when we were young, I'm sure you're going to hear that many times, when we were young, we would run outside and we would play in the yard and we would climb the trees and we would run after the sheep and the goats or whatever dog or cat, whatever pet we might have. And again, naturally improving our immune system with exercise. So that, I think today's lifestyle has taken away a little bit from that, because everything is in front of us right now. We don't have to walk anywhere because we have cars. We don't have to, we have television that we can look at and make ourselves happy with TV. So the outdoorsy thing has become a little bit less of the norm, but it's not everybody. There are people who are quite, committed to doing that. So, but basically, so you want to avoid the harmful threats for your body. You want to eat healthy and you want to exercise. And when I say eating, I also mean hydrating, because we need to eat and drink and also breathe clean stuff. There are some illnesses or diseases which sometimes an individual cannot avoid because they may be genetically predisposed. But a genetic predisposition doesn't always mean that we are going to necessarily suffer from that particular disease, for example, like diabetes. That's a good question, because not everyone may need to take vitamins. And usually we try to encourage the vitamins that we know can help to reduce or to strengthen the immune system are things like vitamin C. I think everybody knows that. Many people know that zinc, for example, is one of the additives. It's not a vitamin, it's a mineral that can also help to prevent influenza and colds and so on. So one is a vitamin, one is a mineral. If one's diet is strong in those two things, that the vitamin and the mineral, it may not be necessary to take them. So it's also important to know that it is possible to overdose with certain vitamins. And so therefore, if someone is not certain about whether they need to take a vitamin or not, then, your doctor should be able to advise you. And sometimes we can do tests to find out whether or not you are deficient in a particular vitamin, and then we can prescribe that vitamin as a supplement. I should mention here, because some people feel that taking iron, which is another mineral but not a vitamin, but some people feel that because if they feel weak that they should take iron. And we have to caution that it is possible to, again, be poisoned by iron. And we don't, or at least I don't prescribe iron unless I can prove that there's an iron deficiency in that individual. And the same thing goes for vitamin D. Many people are taking vitamin D because they think it's right to take it, but they should be warned that vitamin D comes in different doses, in different forms, and it is advisable to be sure that you're not taking too much of the vitamin. That's also possible. I should mention here that vitamin C, everybody knows that vitamin C is relatively innocuous. It tastes pretty good, it tastes like oranges. We know that lots of it occurs in oranges and limes and so on. But do you know that if you take too much vitamin C, you can end up with diarrhea, which can be quite uncomfortable? So again, one needs to know how much is enough and how much is too much.
I stay active by home exercise. I exercise at home because sometimes you don't have the time to go to the gym. So I make myself, active at home. I love to hike. I've been hiking for a long time. I also do Zumba, you two can move. And also my best is walking. I walk a lot around the pond. I love to walk, and I also bike. I have a bike at home. And while you're at home, you just keep yourself active. Seeing that I was in the COVID time, I've been doing exercise at home and then running around, do whatever you feel like doing. Like, you don't have to have doing a lot. You take a time for yourself, for your health-wise. Just keep moving, just keep moving. You could take up 2 bottles of water, you do your exercise. You can do sit-ups on the floor. Just keep active. Just do what you have to do to make yourself active. You don't have to be looking at your weight or how you look, but just to keep healthy. Stay active.
So it depends on the individual. It depends on sometimes their weight, their starting weight, their medical history, their family history is important. Medical history is important. Their physical experience prior to us having that discussion, because not every exercise is for everyone. So exercise can be divided into aerobic exercise and strengthening, and we might want to call it anaerobic, but strengthening exercise. So exercise that is aerobic is something that makes the heart rate speed up. And exercises to strengthen are those that are putting resistance on your muscles and help you to build strong muscles and lose body fat. Now, both the aerobic exercise and the strengthening can help to lose body fat, so a combination of both of those is ideal for anyone who is trying to either maintain a healthy body habitus, a healthy body weight, or lose weight, or even gain weight for that matter. So just to get back to your question, which is how would we advise people to prepare for a particular type of exercise, I think a discussion with one's doctor may be necessary, or we can talk to a gym, somebody who's accustomed to doing training. Anyone who is involved in the teaching of exercise, whichever exercise it might be, most of those persons will be offering some sort of nutritional advice and also physical advice in terms of whether or not they feel that you are a good fit for that particular activity.
I stay active by kickboxing, basically exercising, staying fit, doing a lot of conditioning. That is vital to keeping your health up. Of course, good nutrition, very important, but we keep training. We train a little smarter. We keep more distance. We avoid very close contact. We made the groups much smaller. Also, we advise students, of course, when they have any symptoms of flu or whatsoever, not to come training. The training is very intense, so if anybody has cough and breathing problems, they will not even keep up because you saw the conditioning we just did. But the training, that we do, we try to encourage people as much as possible. Stay fit during this pandemic period. Keep exercising, whether it's kickboxing, but if it's walking on the causeway, walking on the hill, everything, moving is important. Eating healthy, not staying home on Facebook, watching TV and all that. Just stay fit. Walk, run, bike. If you can go on YouTube and you like, for instance, kickboxing, but you do not want to come to a class, look at YouTube videos, try to follow some of the moves. There's enough ways to stay fit. And it just takes 20 minutes a day of a little exercise that will improve your health a lot.
For health-related fitness, Again, it's going to depend on what that person's health is like and what is it that one is trying to do about that person's health. Health-related fitness means having no illness. Is that what you're trying to request? Or are you saying that, okay, if I have high blood pressure, how much should I exercise to help to improve my blood pressure? I would say a walk every day would be great for that. But you might ask, well, should I walk on the flat? Should I walk slowly? Should I walk fast? Should I walk up a hill? And that now then depends on the individual and what they have been able to do in the past, if at all, if they've never done anything in the past. So again, we have to customize that advice to the individual that we are addressing in that case.
You touched a bit.
When you're exercising and you are concentrating on your exercise routine, that can help to take your mind off certain things that may be worrying you. Again, it depends on the type of exercise, because if you're doing strength training, for example, you have to concentrate on what you're doing to make sure you don't injure yourself, to make sure you're doing the exercise properly. However, when you're walking, you may allow your mind to wander, and then you might want to be warned, well, try not to think about the worrisome things when you're walking. Think about pleasant things. Look at the sky. Look at how pretty the sky is in the early morning. Look at the sunset. Look at the trees. Look around and find something positive to think about whilst you're exercising, because as your body exercises, you gain more oxygen, and more oxygen into your brain and so on is going to help your mind to clear of certain things. And you can also actually mentally work out certain issues whilst you're exercising, because you're clearing some of that other cobwebby stuff out of your brain. I have a little story that I sometimes tell, which has to do with homework when I was in sixth form and having a rough time with the mathematics, and going to a picnic and sitting down at that picnic and doing all of my homework at the picnic on the beach, 100%. Just a different environment. I was not in a classroom. I wasn't struggling at home to do something. I was there, let the mind go free, and there it came to me. So this is definitely, and of course, if you're doing something like yoga, for example, in which the intent is to help you to relax, not just your body, but your mind, and incorporates deep breathing techniques and so on, then again, clarity can come to you during that sort of exercise.
Hi, I stay active by playing golf every Sunday here at the Mullet Bay Resort. As far as other exercise activities, I make sure I know the gyms are not available sometimes, so I do my push-ups, I run in the area, just to keep the heart flowing. But Sundays, I get out on the course with the guys and have fun every Sunday. Rain comes, sunshine, we're out here. Golfing may not be for you, but stay active, keep moving. God bless you.
I think that the approach to exercise and healthy living starts with an intent. It comes from here. We need to want to do it. When it comes to the elderly, there's this sort of, tendency to feel, he or she old, they can't do anything. And someone might say that, but then the individual themselves says it to themselves and they believe that. And so they feel that really what they should be doing is sitting down at home watching TV or sitting down at home doing nothing. When, no, this is not what we should be doing. We need to be active. And the thing is, it is true that after a certain age, we can become limited in our ability to move around because our joints get stiff. Maybe we've put on some weight, and we have sort of gradually reduced the amount of activity. So in fact, our muscles have gotten weaker. And so therefore, when we try to do something, we might find that it's difficult because our muscles are not the same as they were 10 years ago. But then we don't necessarily mean that you must go back to doing that. You have to do what's appropriate for you at this point in time in your life, but which is important and which is essential to help you to enjoy your older age and be comfortable. So again, what is appropriate for that particular age group, and that's going to vary from person to person depending on how much that person may have been active or inactive prior to this, the onset of exercise, if we're talking about exercise. For kids, children, just encourage them to play physically rather than play on a screen, because kids are not getting, their eyes are getting exercise. Yes, their brain is getting some exercise. Maybe their ears are getting some exercise, but their bodies are not being exercised. And we're beginning to see an increase in childhood obesity as a result. So I think that, in recognition of that fact, many schools are trying to incorporate more physical activity into the programs that their children are going through at school. Now, right now we have an issue because kids are not going to school every day. They're having to spend some time out of the classroom because of COVID. And so, that may be difficult. And then their parents are at work, cannot, help them at home. And I think it's a bit of a vulnerable, a threatening time for kids in that respect. And that's one of the things that I'm hoping we will see a return to normalcy, sooner rather than later, because I think, we don't want to send that message to kids that it's okay for them to be sitting down and watching television and screens all day. I had a brief conversation with someone today, and we were talking briefly about weight loss. And this individual said to me, sugar is my weakness. And I said to her, you have named it a weakness, and therefore it is weakening you. And you understand that it's a weakness, and weakness is something which is a negative. How about looking at this way? No sugar is a strength. If I don't have sugar, it's going to help me to get rid of my excess weight. It's going to help me to control my diabetes. It can help me to control my high blood pressure. It can help to control any propensity towards infection. That's a strength. So how about turning around what is negative into something which is positive, and look at it from that point of view? And really, what I'm saying is you got to change your mindset. You have to change your mindset. You have to, because everybody, I think, knows that there's certain things in the diet which are not good for you. We know that fat, especially animal fat, is not good for us. We know that sugar, especially refined sugar, is not good for us. We know this. So why are we set on doing that? And okay, all right, let us say we're going to succumb to the weakness. Okay, what can we do then besides that? All right, so can't leave out the sugar. Well, what should I do? Well, why not work it off with some exercise? Because when you exercise, you burn those things like sugar and fat, and that's what helps you to lose the weight that you don't need. There's a lot that we can say about weight. We haven't talked a lot about weight. We've talked a little bit more about nutrition and so on. But obesity, as I think many people know, is one of those other illnesses or other aspects that put people at higher risk. Obesity puts people at higher risk for cancer, diabetes, hypertension. We know COVID too, and certain types of infections. Just the fact that one is overweight without even any other additional conditions. So we have to consider it to be something which is not good for us, and look at leanness as something which is good for us. And stop referring to people as skinny, because skinny is suggesting that that's not something which is good. It's derogatory. You're looking fit. How about that? You're looking fit, you know. Let us encourage, we ourselves as the onlookers and often criticizers. Why not positive, you know, positive criticism or positive, what's the word I'm trying to say? Encouragement to help people to feel better about themselves. I think that's another aspect which is very important, and that is the support of family and friends in the right direction. We have to stop being negative. We have to stop, you know, putting people down. We need to be helping people. We need to be encouraging them to do the right thing. It's, you know, it's a small world.
I stay active for health, but also to maintain focus, to relax, and just as an activity to enhance life. Life's not all about work. You have to have balance, and playing sports, and particularly tennis, helps with that. I encourage everyone on St. Martin to get involved in a sport. It's just walking. You don't have to play tennis. You don't have to be coordinated. Just go out, take a walk. Maybe you'll start running. Maybe you'll get involved in other things. Just stay active.
Right, so, you know, just in case it comes around to me and the why do I stay active? I get so many compliments, you know. They come to me, Doctor, how you manage to keep looking so young? And I say to them, I look straight at them and I say, I practice what I preach. And, you know, that usually hits the mark. They get it. And I'm not lying. I do it. I exercise at least twice a week. And actually, in our family, we are changing our dietary habits now to reduce some of those foods I mentioned, you know. And we feel great, fantastic.
I stay active to maintain a healthy lifestyle. I choose walking as my activity just because it's, you know, it's a stress-free way of living, and I enjoy it. I try to walk at least 5 times a week, and the beautiful thing about it is that there's so many different locations that you can walk in St. Martin. I encourage you to start walking, be active, and maintain a healthy lifestyle.